Good morning, ma'am. I am Kathleen Faith Coranias, your assigned student nurse. I'm going to assess your peripheral vascular system, but before that, I'm going to ask you some questions. Do you experience skin changes, color, temperature, or texture?
No,
How about leg pain, heaviness, or aching?
no,
Leg veins,
no,
leg sores, or open wounds?
no,
Swelling in legs or feet?
no,
Swollen glands or nodules?
no,
Sa past history naman po ma'am, previous problems with circulation in arms or legs?
no,
Heart or blood vessel surgeries or treatments?
no,
Sa family history po, meron po bang nagkaroon ng varicose veins, diabetes, hypertension, coronary heart disease, or elevated cholesterol?
no,
Sa lifestyle and health practices po, do you smoke or other forms of tobacco?
no.
Regular exercise po?
Jogging po.
Okay po. Use of oral contraceptives?
None.
What about po yung degree of stress?
Sakto lang, stress dahil sa ACADS.
Peripheral vascular problems that interfere with ADLS?
None,
Use of medications to improve circulation or control blood pressure?
none,
Use of support hose?
no.
So now I'm done with the interview. Let's proceed to assessing the peripheral vascular system. Before assessing the peripheral vascular system, I'm going to perform hand hygiene. And I'm closing the curtains for privacy. After that, I'm going to inspect bilaterally for size, presence of edema, and venous patterning. Also, inspect bilaterally for skin color. Inspect fingertips for clubbing. Palpate fingers, hands, and arms for temperature using dorsal surface of your fingers. Determine capillary refill time. Palpate radial, ulnar, and brachial pulses. Palpate epicrochlear lymph nodes behind the elbow in the groove between the biceps and triceps muscles. Perform Allen test by occluding the radial and ulnar arteries and observing the palm pallor. Then release the ulnar artery and watch for color to return to hand. Inspect bilaterally for skin color and for distribution of hair. Inspect for lesions or ulcers. Inspect for edema, unilateral or bilateral, and palpate skin temperature using dorsal surface of the hands. Palpate popliteal, dorsalis pedis, and posterior tibial pulses. Perform position change test for arterial insufficiency while client is in the supine position by placing hands under both of the client's ankle. Raise legs 12 inches above the heart level and ask client to pump feet up and down for 1 minute. Next is have a client sit up and dangle legs. Note color of feet. Time the interval for color to return. We're done assessing the arms and the legs. The skin color and the temperatures are normal. I didn't see any abnormal findings.